Hello, soon-to-be nurse practitioners. I am Miss Cohen, and this is Nurse Practitioner Board's Review, Gerontology. Table of contents. We're going to go over some terminology you have to feel comfortable with when taking the exam. We're going to discuss gerontological unusual findings, pharmacological considerations. We're going to go over neurological dysfunction with aging and talk about screening for dementia, delirium, Alzheimer's, Parkinson's, and sound downing phenomenon, and I'll teach you how to differentiate between all of these. We're going to talk about the aging adult and review system by system. We're going to talk about common diagnoses in the elderly, such as eye conditions, dermatology, cardiovascular, and constipation. We're going to be talking about common cancers in the elderly, and our last topic will be elderly abuse. So terminology, guys, you have to memorize this. So go ahead and print this lecture, grab this sheet, fold it in half, and go over your terminology until you memorize it. You have to know these terms. So abulia, loss of motivation or desire to do tasks. Amnesia, memory loss. Anomia, trouble recalling words or names. That's an easy one, right? Anomia, names. Aphasia, I'm sure you know, difficulty using or comprehending speech. Apraxia, difficulty remembering learned skills. Asterognosis, inability to recognize familiar objects placed in the palm. That's when they ask you, when they're doing the mini mental exam, I think it is, where they put a piece of an object on your hand behind you and you have to tell them what it is, like a paper clip or a penny. Okay, ataxia, difficulty coordinating voluntary movements. Broca's aphasia, that's the able to speak but unable to comprehend. Dyskinesia is abnormal involuntary muscle rigidity, and dystonia, it's involuntary repetitive muscle movement. Really make sure you know these terms. So when we talk about unusual findings in the elderly, right? Acute cognitive dysfunction, acute meaning it's happening within hours, if not few days, right? Confusion, delirium, and agitation is not normal. All right, so possible diagnoses will be like an infection, right? Pneumonia or UTI. With pneumonia, you have fever, chills, the cough. It could be productive or non-productive with the elderly. They may have decreased appetite, weight loss. They may be tachycardic. And remember that strep pneumo is lethal for our elderly. Make sure you review the respiratory system lecture that I have, where we talk about the differences between the community acquired pneumonia versus the young pneumonia. Well, in this case, strep pneumo is lethal. That is why we vaccinate our elderly with the pneumococcal vaccine, right? The PCV13 and the 23, we've got to make sure they have those in their system. So a UTI, I know you've heard this before. It's the most common cause of acute mental change in the elderly. It can be asymptomatic. It could cause sepsis. But here's the thing, when a patient who's elderly is confused, it has delirium, is agitated, they're at high risk for falls. And remember, we'll talk about this later, we can't afford our elderly to fall and break a hip because they die, okay? Okay, and MI, it could be presented with fatigue, back pain, mild chest pain, diaphoresis. All right, hypothyroidism, huge with the elderly. Severe constipation. Remember, hypo, everything is low and slow. So constipation, unlike diarrhea, which is fast, right? Weight gain, because they're not moving much. Dry skin, cognitive issues. They have apathy, right? So if you have an elderly patient that comes into your office who presents with acute cognitive dysfunction changes, or a family member brings them in and says, my grandma or my mom, my whatever, is not behaving like they normally do, what kind of labs would you order immediately? All right, and no question that you're going to do a CBC, because in the CBC, you're going to find infection through elevated white blood cells. You can also find anemia, which can cause confusion and lethargy and all these things. You're going to order a CMP because you want to check their kidney function. You want to check their liver function. You want to check the electrolytes. If they're dehydrated, they could have acute cognitive dysfunction, okay? Certainly a UA, to rule out a UTI. Your thyroid, guys, you cannot forget about your thyroid function to see if they have hypothyroidism or hyper. They may be hyper too. Hyperthyroidism can cause confusion and delirium because they're so agitated. All right, certainly B12 and folate, you got to squeeze in your anemia. So most importantly, CBC, CMP, UA, and a TSH. Those right away. The B12 and folate if you don't find anything or if you see anything in the anemia category question in your head, okay? So pharmacological considerations with the elderly. So remember with our elderly, their absorption rate is altered, right, of these drugs because they have increased fat in the system, which extends the half-life of drugs and fat-soluble drugs. So the distribution will be altered, the metabolism will be altered, the excretion will be altered because they have renal impairment. They don't drink water. Old people don't like to drink water because they don't like to go to the bathroom all the time. They prefer to be dehydrated and not have to, bother. And remember, with age, there's less efficient P450 system with the metabolism of drugs, okay? So remember with our elderly, and I know you've heard this before, you start slow and you start low. So for example, if you're gonna start them on a thyroid medication, Synthroid, whatever, let's say the recommendation dose is 25 is the normal, give them half. Start with 12.5. See how it affects their system and then slowly increase it as needed. Okay, start slow and start low. And also consider that our elderly may be taking multiple drugs. This is called polypharmacy. So you have to be very conscientious about drug interactions. They may also be taking herbal supplements, or there may be some confusion if they took their drugs already or they didn't, and they may be double dosing. So things to consider with our elderly. And they have an increased sensitivity to medications. For example, remember the antihistamines is a huge category. Warnings, it may increase constipation, urinary retention, blurred vision, dry mouth, orthostatic hypotension, because that's what antihistamines do. They dry you up, all right? So it may cause all of these unwanted side effects on our elderly. Benzos, all right, confusion, delirium, again, falls, which equals fractures, be careful. Antipsychotics, confusion, apathy, again, risk for falls. Cardiac drugs may increase the risk of orthostatic hypotension. Our elderly get up in the middle of the night to go to the bathroom 1,000 times. If they have these drugs in their system, you know, it may cause them to fall and trip over stuff in the middle of the night and get hypotensive. NSAIDs, remember, it increases the risk of GI bleed and PUD. So keep those in mind. So let's talk about neurological dysfunction with aging. If you found this review helpful, I welcome you to come and check the remaining of the review at cohenreview.teachable.com. In this website, you'll find other reviews that I have uploaded covering many systems reviews with the purpose of helping you study and pass your boards. In addition to the reviews, I also offer one-on-one coaching. So if you're not sure if you're ready to take the exam or not, come and shoot me an email. Let's talk about it. I'll set up a one-on-one meeting where I get to assess your readiness to take the boards, and I can give you some kind of study guide into what your weaknesses are and your strengths are, and we can talk in more detail so I can better guide you into studying for the nurse practitioner boards. So best of luck with your studies, and if you have any questions, feel free to email me at shiracohen@gmail.com. Good luck.